my issues in clinical when I was in school, I could barely get the bubbles out of the insulin syringe when I was, withdrawing the insulin. It was a problem every week. I don't know why, but it was a problem. She was annoyed with that. And she also she just was not very nice to me. And it got to a point where one instance, I was on a unit. It was a unit that had patients who have a condition called MRSA, where you're supposed to be gowned up, you're supposed to have gloves on, mask, and it's contact precautions in place so that you don't, transfer any type of bacteria or viruses or things like that to other patients, but also you keep yourself safe with your PPE. And we were changing the patient together, and we were adjusting the diaper or chuck, and it was one of the two. And as we were maneuvering the patient, it actually ripped. So I vocalized that it ripped, and this instructor, to shut me up, literally took her finger, her gloved hand, and touched my nose to shut me up. And that was just...
First of all, that's disgusting.
Disgusting, inappropriate, and a violation of my safety and PPE.
Right.
I'm not supposed to be touching my face. I mean, like, we all may have a little MRSA on our skin or things like that, but like that's inappropriate. And I never told anybody about it. There was
you never
this
said
whole
anything to the school?
I never said anything to the school because there's a power dynamic of, if I report this behavior, if I report how this person is treating me, I may fail my class. And ultimately, I did end up failing my class.
Oh, wow.
But it had nothing to do with that day, but it had something to do with another day.
Oh, wow.
Yeah.
Oh, my goodness.
That was my only class ever in life that I failed. Wow. And it was a 6 credit class.
Wow.
And I went on academic probation, and it was like the worst time in my academic life that I had to experience.
Wow. Yeah. But look at where you are now. I mean, I know that I'm sure that was devastating, in the moment, but I am such a firm believer of everything happens for a reason. We don't know why, and ultimately it does work out for your good. It just, you never see it in the moment. Maybe perhaps now that you look back, but even just in things like that happening, you never know. Something like that happened to you, and you have no idea who you're gonna meet where something like that may happen to them, or is leading up to it. And you could kind of like, listen, I went through this. You never know who's listening to it now that like could literally be going through the same thing.
It was my senior year. It was a 180-hour clinical, and people who fail, they fail the class because of lecture, didactic. They don't fail because of clinical. Yeah. So week 12 of 13, I failed my clinical.
Wow.
Why? Because as a student, you get into this routine when you're in clinical. You come in, you're all bright-eyed, bushy-tailed, and you're, hey, patient A and B, you do your assessment, you give the meds with your instructor. Lunchtime comes, you probably gave did the chem sticks, and you give the insulin, and then you went on lunch. Well, I came back from lunch, and my patient required blood pressure medication. And what did I do? I gave the blood pressure medication, but I did not do a second blood pressure check. And the patient's blood pressure went to systolic of 70s. And
blocker.
For us,
give him metoprolol.
For us, we don't want patients' blood pressure to be low, but at that time I was devastated, obviously, that the person's blood pressure was that low. But another level of context, the patient was a hemodialysis patient.
Oh my goodness.
So you can imagine
a double whammy.
somebody who has hemodialysis, where they are typically removing fluid, waste from the person, the blood pressure will probably be low.
Right.
And here I am adding this medication on board, not applying the critical thinking that is needed as a nursing student. And, and that's the thing. You're going to have these blinders that hit you, and this additional factor that you may get comfortable, and then here you go.
Right.
And so the blood pressure went low, and I was a little bit in shock and, very afraid to continue to work with the patient. And the instructor was like, no, you have to continue working with the patient. The patient was fine. The patient's blood pressure improved, but it's something I'll never forget for the rest of my life, which is I would always make sure that I do vital signs before any medication that's going to be given that's going to adjust or change someone's heart rate, blood pressure, respiratory rate, any vital signs. So
Yeah.
it stuck with me forever, but they failed me. There was no let's write a summary or a report about why this was a problem. It was no, you're not passing.
Wow.
And so then I started to say, well, what next? So then I had the potential to do summer school. And I wanted to be at the Glenn Lewis concert back in the day. Like, I never did summer school. So the fact that I had to do summer school potentially was devastating. So I was told no, that I could not do summer school. Right?
Oh, wow.
Right? And then the thing was, if I did not, I had one more semester, I believe. So this is one more semester of clinical, a community clinical, which is 100 hours. I would have had to take the 100-hour community clinical with the 180-hour, like it would have had to be stacked. And I wouldn't have I wouldn't have graduated on time. So I went to my clinical advisor, my program advisor at the time, who was a mentor of mine now. This program advisor helped me create actual letter, right, to say, I need to take this class in the summer. Like, you need to, So I did do that, and they did grant me it after I had to do that letter.
Wow.
It was only after that. So if somebody is not there looking out for you and supporting you and providing you guidance,
Yeah.
that was a whole nother story. I mean, and she's an angel in disguise. I mean, she was the only actually Black professor who was tenure.
Wow.
Everywhere, that was it. The only Black professor left at the institution. And I believe she really helped me. So if it wasn't for her, I wouldn't have been able to take that class in the summer. I wouldn't have been able to graduate on time.
Wow.
And
Wow.
the hardest part 2 was I had to take the summer course again with the same instructor.
Oh.
I cried every
goodness.
Wednesday. Every Wednesday before I went to clinical, I cried because she was just so not nice to me.
Yeah.
And I always thought about her over the years, and I was kind of like, if I see her, like, what would that be like? What would I say to her? But that's what made me wanted to get into education. And, like, that's the story. Like, that semester, that is really what made me want to be there, to be at the front, to say, hey, guys, you can do this, to be a light for people. So that's that.
And look at you are a light. I think
Thank you.
It's a testament to your character, the way that you literally persevered through the pain, right? And look at how you are on the other side. You're there for people. You're teaching people. You are literally a light to other people, so they don't have to experience that. So it
Thank
wasn't
you.
wasted,
Yes.
It wasn't wasted.
A test is a testimony, right?
Yes.
And then, turn your message to a message. That's what they say. And that's why I enjoy teaching in the hospital. I enjoy sharing any kind of resources that I have. I've always been resourceful. I won't say that I'm the nurse whisperer or anything like that, but like I always felt like people appreciated me listening. Like if
Yes.
somebody was perhaps harsh with them, they appreciated me giving some support, comfort, a different side, or, a little bit more explanation about something. And they would always say, thank you so much,
Yes.
in various arenas. And that's why I started my company, Nurtured Novice LLC.
Oh, let's talk about it.
Yes. So my company, Nurtured Novice LLC, is a nurse career consultancy. It's really to help nurture the novice. So early career nurses, nursing students, to help them navigate the challenges that they might experience. Because we see all the nurses, they're on social media, they're so excited. They graduate, they've got their, outfits. I wish I had lovely photos back in the day when I graduated, stacks of books and then a syringe.
You just had the Florence Nightingale cap with
I can't
with
find
the lamp.
not one photo of my of my nursing student
Well,
career.
it's not too late to take a picture.
Maybe I can do that,
You can
but like
recreate it.
they're so excited about what they've accomplished. They're like overjoyed about passing their boards exam, and then they get into their unit, their first year, and then they're just like, I don't want to be in nursing. I hate this. This is awful. I need to leave. So I'm trying to help people navigate that first year, the first few years. I'm not saying that you have to stay in location A or B, but I'm trying to give them the tools so that they can be as prepared. I can't control staffing. I cannot control leadership behavior, but I can help you identify opportunities that are not safe. I can help you navigate challenges. I can help you with communication. I can help you with navigating prioritization. I can help you identify things like if you're having a difficult time with self-care, if you're having problems at home in terms of how to navigate home life with work life. Even if you're trying to prepare for an interview or you're trying to start a school program, I can help with those type of things. So I offer services like consultation services. I offer job prep, mock interviews services. I also offer conversation cards. So I actually have some conversation cards here.
Yes.
So they are called Nurtured Novice Conversation Cards for Nurses.
Okay.
It can help you with your professional development. It can help you with reflecting on where you are. It's meant for you to have a conversation with other colleagues, other nurses, students, and you pick a card and you have a dialogue and
Let's
you learn
test one
from
out.
each other. All right.
Let's test one out. Live and live in color. Nurtured. What is it? Nurtured
Novice Conversation Cards.
Now I'm not novice, but I'm gonna pretend like I'm a novice. So go ahead, question me.
Okay. So share an experience where you advocated for a change in the healthcare system to better meet the patient's needs.
Woo.
So this is a one that a nurse can potentially answer.
Repeat it again. It's share.
Share an experience where you advocated for a change in the healthcare system to better meet patients' needs.
When I was working in med-surg tele, one of the things that I did not like, and I'm sure anybody that works any type of med-surg floor understands this, is you can get report at any time of the day.
Yes.
You can get it at the beginning of the shift. You can get it during a rapid, before and after. Your patient can be a rapid coming. It's chaotic.
Yes.
One of the things that I will say that we actively we will always speak up about is safe report. It doesn't make sense. Now, I think people do put off getting report in certain situations, but I'm talking about in a safe situation. And so I made sure one of the things that that I would do is making sure I had like a quick cheat sheet on how of my report, because I know I have to be quick.
Of course.
The ED, I'm sure, is going to be like, I don't even have time for nonsense. So I created that, and that was something that I shared on my unit. I don't think that it was something that ended up going around, but I was something that I would do when I was precepting. I would show any new nurse exactly what to write down. Write these things down. Exactly. Start off with your head to toe. What's the neuro? So I would literally write neuro, skin, heart, lungs, and so I can just jotting down information to make it easier and simpler for me to get the pertinent information that I need, cut through the BS, or get the information that I do need because you're not telling me everything. And so that was a way that, and I don't know that it made a system-wide change, but in terms of making a change, even if I was to, even though to me it affected people on a smaller level, where I'm now introducing it to my orientee, who can maybe now, when she or he becomes a preceptor, they can do the same. So kind of can expand. But yes. I think that was a way in terms of getting safe report, because that's important. And you never know. You could literally get a patient and end up in a rapid, and then now you're the primary, right? And so even though you don't know the patient, now you at least have something quick, as opposed to writing kind of nonsense down, the patient, 73-year-old male here from, had an accident at home, and just kind of just cutting through all of that,
right?
All the fluff,
helping them, because and if they're a new nurse, they struggle too with getting concise,
Yes.
And so it's hey, let me tell you what's really important, not something that happened 5 years ago.
Right.
We need this information to be expressed when you're calling a provider. We need you to understand why the person's admitted, because you can ask a nurse, what's going on with your patient, or why were they admitted, and they're like, oh, we're giving insulin. No. That's not the reason why they were admitted, or the treatment is not the reason why they're admitted. The admission reason is what I need to know. So sometimes they're not so specific. They're not so granular, because they're still doing tasks. They're task oriented, and they don't understand the why. Why are they doing what they're doing?
Yes.
Why are they doing these treatments all day long? What are they assessing for all day? What variances can occur?
Right.
And so they need to know why that person's admitted. So having a thorough report, and you'll see now nurses are creating these lovely sheets that they're sharing with the orientees, making copies or making it their own, and doing some extra little piece that it's oh, this is helpful. I used to do little stick figures, and I used to do ACE assessment, care plan education. I used to put that. I used to put my little times that I need to get my meds. But people have so many systems, but that is extremely important. Yeah, so that's one example of
You want to do
the
one more? I could
questions.
do one more.
Sure. These questions are good for nurse residency programs, icebreakers, student nursing associations, anything.
That's great.
And they are, okay, so let's see. How do you approach delegating tasks to nursing assistants and patient care technicians?
Oh my gosh. So okay. I would ask them like, hey, are you able to do this out? Sometimes I'll just ask them like, are you busy? Are you free? Because they're honestly sometimes just as busy or could be even busier than us sometimes. Even though like our roles are like different, but we are all working together. So I generally approach people in a warm way. I'm never like, do this right now because I need it done, like, whatever, while I'm sitting down. If I see my PC or my tech is busy, and even though I'm busy too, I'm not going to interrupt them because I can physically see that they're doing stuff. And so I will go and do my own blood pressure. I will go and do my own whatever, my own, lab if I needed to or something like that. But in general, I would just approach them in a warm way and just ask, hey, when you get a chance, can you do such and such? Or I need this, do you mind? Or there's times when I need them to help me. Like I'll try to plan my assignment. So if I know like I have a heavier patient, maybe I'll do that one last, depending on the acuity of whatever's going on. And I'll say, hey, can you, maybe start with so-and-so, and then we'll meet at 10 o'clock so that we can do Mr. Smith's dressings and, and we'll do that together. If we know we have to change the bed. So I'll just try to make a plan if I can. But in general, I'll just ask them and with respect and not
that's key.
Not coming down on them. Like I'm the boss, I'm the RN. Like, that's never idea. that was one of my biggest challenges was delegation. And the thing you have to think about is the person that the day one, as a nurse on day one, you are a supervisor, right? You're supervising ancillary staff. Right. You're supervising nursing attendants, nurse techs, patient care techs, whatever the equivalent of the title is. But you are a supervisor. So the follow-up is extremely important. But you can do 10 things, and they can't do the 10 things. So they can do some of the things that you can do. So you have to make sure that you're asking for help or you're going to drown. Right. Everybody's role is valuable. And so respect is important, right? Communication is important. Timely communication and really managing like expectations. Like if there's one person for 25 people, are you going to expect them to do vital signs for the whole floor plus, hygiene care for everyone? Right. No, the nurse is going to have to be involved. Right. You can't just say, I got my degree, I'm not helping. That's part of your role. Right. But delegation is hard because you don't know what type of, interactions that person has had with other people. Correct. Some people have been rude to them. So then they've got their guard up like, Or sometimes you get responses that are not supportive of the environment that you need to have. So if you're here to care for a patient, I don't want people to ask the questions, will you, can you, are you free? Because they're going to possibly lead to, no, I'm not free, or no, I can't help, or I'm busy. There are levels, right? You see somebody visibly is busy, that's one thing. If somebody's making an unoccupied bed, okay, we can scratch this for right now. Right. Yes. Can we focus on this? But I say it's important to express the urgency if there is an urgent need. Patient Larry needs stat EKG. I'll try to take out the can you help me? You're not a volunteer. We're getting paid. Let's work together. Patient needs. I don't need. Patient needs. And that's been challenging. As new nurses, when you're on orientation, you're usually asking your preceptor. Your preceptor is your person that you are getting help with it. And when you get off of orientation, then you're trying to play catch up. No more. Then you got the big girl pin.
Right. So it's going to be some challenges, and you're going to have to try to figure out a way to really go, can I talk to you for a second? It seems like, we got off on the wrong path. I asked you a question and you either rolled your eyes or you ignored my question. I just want to understand what's going on because we have to work together. Right. We're colleagues. Right. We need each other. I want to have a positive working environment. So that's been a challenge. I've had closet discussions with people. That's the challenge. But we're all human and we're all there. But lazy people don't come to work. Like just find another place. Yeah. Like We don't want you there. We don't want lazy people when whatever
Right.
role you're in. It's like, I don't care if you have 5 jobs. Like, this job is supposed to be equally as important.
Right.
Come here, show up, work hard, and we can move faster, and we can also take care of the patient. The patient needs our help. And so that's a very, passionate topic of mine. It's like, oh my gosh, when you don't have the help, it affects you.
It
But
definitely
also, you
does.
don't want to work with somebody too that's like nasty, sting attitude.
Of course.
You'd rather go to somebody else, and unfortunately, that other person might get so many of the other requests that they might get burnt out. So you got to be
Yes.
mindful of that too.
Yeah.
Yeah.
Yeah. I always try to so for example, on the unit I work on, I do see a lot of that where there's the techs will work, hard and long, but I would say maybe 50% of them are lazy, or they're just not doing as much. Let me not say lazy. They're just not doing as much or putting as much work, that someone else would put in. So sometimes people tend to ask okay, I know this person's going to do it versus I'm not even going to waste my time. And so then it does become a burnout situation. So for me, what I always do is I always try to help out where I can. So I always try to make sure, for example, the unit I work on, a lot of the the techs are kind of more responsible in stocking the rooms, making sure the room is clean. So I make sure the room is clean. So I don't just leave things kind of laying around. I'll clean up as I'm going along, just to kind of also help out, whether I'm busy or not.
Right.
I will always just try to do so. Even just doing those small things. When I was in tele, I would definitely, if I could do my own blood pressures, then I'm gonna jump in and do those. I'm not gonna just be sitting back and just I know you
Can you
can
put the
do
person
it.
on the
You can do
bedpan?
it. Yeah.
Could you
Right.
put the person on the bedpan?
I will not only put the person on the bedpan, I'm gonna take them off. I'm gonna clean them up. I'm gonna if I can change the sheet, because I think about it, and what if that was my mom, right? And
That
so
part.
you treat people how you want to be treated. Yes, you might have a million things going on outside of work. You might have the craziest day. You might have just came in and had the worst news ever, and it affects you. We're all human, but we're also here to work, and you are taking care of someone. Nobody wants to be the person where as a patient, I have the crappy nurse, I have the crappy tech, I have the crappy whoever, doctor, whoever it is, and it's because you're going through something, and I'm getting the brunt end of it.
Which is
I'm
not
here to,
good.
I'm not here for funsies. I mean,
Right.
some people do go to the hospital for funsies now,
Right,
but
right.
you know what I mean? I'm here because I'm unwell and I need to be well,
Right.
So you try to do as much as you can. And you help people out. It's not, this is not an autonomous job.
Right.
So yeah.
I mean, being grateful, we have a job, right?
Yeah.
This is a business. It is a profession. But also, I mean, there's people who are in nursing who don't really care for, caring for people.
Right.
And I'm just find
Baffled.
another place.
Yes,
There are
yes.
so many adjacent positions and professions that you can get into.
Right.
That you don't have to have the grueling, constant 8 to 12 hours with the patient, okay? You can see them for 2 seconds and then they can move along, right?
Right.
But this is a caring profession, and I don't want to be that patient that you don't really want to be there and caring for. I don't want to be that. And
Right.
you can see that kind of behavior. And so that's something, that's another thing that's just get it together. But you can see these are some questions that
The questions are good.
Thank you.
It's definitely a conversation piece for sure. Where can the people find the cards?
So they can find them on my website on nurturednovice.com. They can find them on Etsy. They can find them on TikTok at Nurtured Novice Conversation Cards.
Okay.
And so you can use them in a lot of, areas and a lot of meetings. And so even if you don't know the answer, someone in your group may have had an experience that you learn. It's
Yeah.
kind of like you said, with the clinical, having all the people in the room and seeing one person's experience, you're still learning.
Right.
So someone sharing their actual experience will help another person. And if it's something that you didn't encounter already, it'll help you prepare or think about how you could answer it or in participating in it in the future as a practitioner, as a nurse.
Oh, it's just such a great idea. I can't wait to see Nurtured Novice on every hospital site. This is part of built into the orientation.
Nurse residency,
Yes.
part of your coming in. It's part of your your residency program. Package, you get that, or in your school when you have to pay for apps and things like that. It's hey, here's your cards. I'd love to see that there.
Yeah.
So, yeah.
That's such a great idea.
Yeah, so I mean there's a lot of cards out there for affirmations and things like that, but a lot of those scenarios in there are either for professional development, information about how to, advance in your career, or self-care, or even things about, parents and how people treat you, and cultural differences, and socioeconomic status, and social determinants of health, more likely, is in that. So it's a lot of, mixed questions.
Oh, that's so good.
Thank you. Thank you.
Jasmin, thank you so much for joining us on the nurse aspect. This was such a pleasure. I'm so glad that you got to talk about the Nurtured Novice. I hope, goes far and wide, because I think that it is very helpful. Hearing about your journey, I had no idea about epilepsy, which I'm sure a lot of people may not have heard. So that was also definitely interesting. Thank you so much for sharing. Do you have, last question, do you have any tips? I know you shared a couple of tips, but do you have any tips that you would want to either share with either your former self or a peer, or something that you wish you knew that no one ever told you?
I won't say there was nothing that no one ever told me. I was able to get a mentor early on, and I have like 5 mentors now.
Okay.
My younger self, I would just say give myself grace and patience. And you belong where you belong. Like, you belong in that room. You belong just like everybody else. Some people, they fake it till they make it. But, sometimes you second guess yourself. Just, you belong there. Okay? Everybody belongs where they belong. And so just speak positivity in your life and get like-minded people. And some people are not going to see your vision, and you don't listen to them. You got to find the other people. Network.
Yes.
Network equals net worth. So you gotta
gems.
find your tribe and have people speaking life into you, because there are people who will radiate, a light, and then there's people who are energy vampires.
Yeah.
So take heed to that early on to save yourself some headaches, and find the people who are going to encourage you and inspire you.
Well, thank you so much. That was a great tip. Oh my
thank
goodness.
you.
I feel like that's spoken to me.
Yes. I'm speaking to myself now. And, there are people who are there for you. There's people who so pseudo for you, too.
Yeah.
And so you just got to be like, oh, okay, I see that. And you know what? Work on yourself. And that's it.
All right.
But there's always somebody positive speaking life. But I can tell people where they could find me.
Yes, go ahead.
Okay.
Of course.
So Jasmin Waterman Paris. That's my full name. I know I didn't.
Full government.
Full name there. You can find me on LinkedIn, TikTok, Instagram. You can find me on Facebook as well. And you can reach out to me for booking a consultation at www.nurtured, Nurtured, novice, novice.com. And I am, available virtually. I can come to your schools, come to your residency programs, your hospitals. I can be a lot of places. So
Nurse Jasmin travels, honey.
I go.
Okay?
I will go.
She is go where she is needed, boy.
Yes.
Fills the void. Okay.
And I thank you for bringing me on your platform.
No
and
problem.
this was awesome.
Here. Thank you so much. Now, if you guys ever want to be on the show, you can email me at thenurseaspect@gmail.com. I'm also available on YouTube on all major platforms. So let's connect. And you can also follow me on TikTok if you want for nursing nonsense. Okay.
I love it. I love it.
All right. Thanks, guys. See you on the next episode.
Bye.